नेपाली का लागि नेपाली तर हामी पनि आएका छौं नेपाल र नेपाली का लागि. I've been involved with this project now for about a little over 3 years, and I've seen the struggle, the sweat, the blood, the tears that have been shed. And we would not see this had it not been for the singular commitment, passion and patriotism of one man, Dr. Upendra Mahato. And I'm not joking when I say this, because I had not committed myself to Kathmandu until very recently. Because I felt that in Nepal, I could probably make a humble contribution to the healthcare landscape. Elsewhere in India or UK or China, I might just be part of one institution. But through Mediciti, we could probably make a change to the healthcare landscape of this country. So before I welcome everyone, I want to personally express my gratitude to Dr. Upendra Mahato for doing such an ambitious, and sometimes we say crazy project in Kathmandu. Congratulations, Dr. I would like to now present to you the scenes behind Mediciti. Firstly, to the NRNA community. Can I have the lights on, please? JCI standards. The total facility, when it is completely open to the Nepali citizens, would be about 750 beds across 600,000 square feet of built-up area and about 8 stories with a helipad. Very well connected in a campus that's about 26 acres with great views of the Himalayan ranges. So I'm sure some patients will get cured just with the views. Safety and quality have been 2 reasons why Nepalese tend to travel to India or Thailand or Singapore, because there is a trust deficit. Nepalese citizens tend not to be comfortable, and there is a reason for that. And therefore, this institute has been built and will from day one function on towards JCI standards. We are starting our NABH accreditation program from the middle of November, and we will be the first hospital in Nepal to secure both an NABH and an NABL accreditation. Phase 1 of the master plan, we will have 350 beds open to the citizens of Nepal, and not just Nepal, to the citizens of South Asia. Phase 2, within the next 24 months, our plan is to open up 550 beds, and then within 3 years, go to 750 beds, so that Mediciti becomes one of the largest tertiary quaternary medical hubs in South Asia. This is a walkthrough, this is where you're sitting. Looks 5-star, doesn't it? But it will not cost you 5-star. I know a lot of you here are thinking, can an ordinary Nepalese afford this? Absolutely they can. And I'll talk about that briefly. That's the lobby, that's the reception, that's one of the OPDs, that's our dry chemistry laboratory, absolutely state-of-the-art. Our modular OTs, Siemens Skyra 3 Tesla MRI, which otherwise is only present in Kokila Bed in Mumbai, is here in Kathmandu now. The daycare programs, our CSSD, so that a lot of infection, a lot of disease-related issues pertaining to infection, both nosocomial and otherwise, have been taken care of by some very good equipments and programs, including, you can see the dialysis there, that's the Skyra, that's just some technology. You don't have to worry about this. The point I'm trying to make is Dr. Mahato has made no compromise on the quality of technology that is available in this country. The first thing about medicine is diagnosis. You get your diagnosis right, treatment is probably sometimes possibly easier, but most of the times in Nepal, you don't get a definitive diagnosis. But I think with our team of doctors here, who are full-time, for the first time in the country, we have all doctors full-time, there's teamwork. With this technology, you would get a definitive diagnosis, and therefore, you may not want to travel abroad for treatment. Okay, we have this great infrastructure, but hardware is just part of the problem, or part of the piece. In fact, where is Dr. Ram? It took me so much time to convince him to join us full time, but I'm so glad that Dr. Ram is now part of the team. Dr. Gopi Ariyam heads laboratory medicine. Department of Neurosciences, Dr. Gopal Raman Sharma, an iconic name in neurosurgery, and we are talking about patients already considering coming from India for malformation of certain venous problems, and we might be seeing patients coming from India. So Ganga ulti behne wali, just a matter of time. And Dr. Baburam Kokre in neurology. Department of Digestive Diseases, Dr. Sunil Kumar Sharma, Dakal, and Dr. Umid Sreshta. Department of Cardiac Sciences, Dr. Lava Joshi, Dr. Vijay Raj Banshi, Dr. Ranjit Kumar Sharma. Department of Renal Sciences, Dr. Mahesh Adhikari and Dr. Neeraj Singh. Department of Otolaryngology, Dr. K.C. Thoran. Department of Orthopedics and Joint Replacement, Dr. Shishir Rakhe and Dr. Raj Rana. Of course, they have their own team members. I didn't have enough space to put everybody's photographs, so I'm introducing you to the heads. Department of Women and Child Care, we have 3 wonderful ladies. 2 photographs are here, 1 photograph didn't come on time. Dr. Neera Singh Sreshta, Dr. Anya Sharma, I always get her name right or wrong, A-N-N, I always say A-N-Y. And Dr. Suchita Joshi in neonatology, I didn't get her photograph on time, not my mistake. So we have a wonderful team in women and child care. Department of Wellness, Internal Medicine, Endocrinology, one of the most passionate doctors I've met in my career of 25 years, Dr. Mimi Giri. Department of Anesthesiology, Pain and Critical Care, 2 young, passionate physicians, Dr. Apurva and Dr. Diptesh. Department of Dermatology, Opthal, Physio, Dental. Oh, Dr. Akilas Purvas Kamala. Must have been a last minute addition. Dr. Pooja and Dr. Pratibha in Opthal, Dermat and Physio. We don't have Dr. Manju Gewali here today. She will be taking care of Physio and Rehab. Department of Oncology, Dr. Pankaj Burman. Dr. Sanjay Karki, some of you might not know, is the world's, not India, Nepal, is the world's first certified EMR for aviation emergency medicine. The world's first certified, and he's with us today. We're very proud of him and what he's going to do with our emergency medicine, Dr. Sanjay Karki. Okay, so we have great infrastructure, we have good equipment. A lot of them were with many hospitals, and given the traffic, a lot of them were stuck in traffic. Patients are waiting in the OPD or for procedures, and that needed to somehow stop, and therefore we spoke to the doctors, and if the doctors had not joined us in this vision, this would have been impossible. So one institute, one doctor, world-class technology and advanced equipment, whether it's in diagnostics, or in procedure, or in physio, or in rehabilitation. Most important thing, a team-based, multidisciplinary approach. Today, everything has become an organ, right? But a patient is a whole. He may have a cardiac problem with a gastrointestinal bleed, with a back pain, but doctors only look at their organ. So if a urologist doesn't see a problem in the eye, there's no urological problem. But unless we get the team together to work as a multidisciplinary team, you don't bring in safety. And I think we have all our doctors committed to what we call multidisciplinary team care on demand and outcome-based management. Most of the time, when you talk to people about hospital, they'll say, "Hamare itne bed hain. We got 700 beds, we got 800 beds, we got so many ICU beds." It's all about science. We want to change that conversation and say, what is our infection rate? What is our morbidity, mortality? What is our recovery times? How much time do you have to spend? Today, Nepali citizens spend the entire day in the hospital. If you spend more than 30 minutes waiting for your appointment, it's my failure. And we want to change some of that so that we show respect to the Nepali citizens' time. So therefore, outcomes-based management. And finally, it is about 2 people, the patient and the physician. Patient engagement and physician alignment. So how can Mediciti changed the healthcare landscape of Nepal. Here is some numbers for you, and this shocked me, okay? This really shocked me. 173,000 Nepalis went abroad for treatment in 2014. About spending lots and lots of money. Approximately $4,500 per person if you include the travel, the accommodation. $6 billion or more goes out as forex from Nepal with respect to just healthcare. And average morbidity and mortality could be as high as 40%. This is why patients are going abroad. And this needs to change with good processes, management, and patient-centric care. So there is outward patient flow, there is increased healthcare expenditure, we don't have adequate manpower, public healthcare is about 2.5% to 3%. There is no health insurance in Nepal. Health insurance in Nepal is under 1%, under 3%. And therefore, we've started talking to insurance companies. Dr. Manu, I just heard that the government approved a micro-insurance scheme. I just heard it from somebody, I don't know if that's true. If that is true, we're planning to work with insurance companies just like we have Yashaswini or Rajiv Gandhi Arogya schemes in India and other parts of the world, so that common Nepalis can access a facility such as Mediciti. Without putting this together, we will have a problem here. 25% of the population is below poverty line. About 12% of Kathmandu is under below poverty line. So therefore we decided that dialysis and a lot of other government programs we will offer at the government rates. So therefore, Nepali harulai उपचारका लागि विदेश जानु पर्दैन भन्ने विश्वास दिलाउँदै स्वदेश तथा विदेशमा रहेका नेपाली स्वास्थ्य कर्मीहरूलाई नेपालमै बसेर देशको सेवा गर्नुपर्छ भन्ने भावना अभिवृद्धिका लागि हामी विश्वस्तरीय संरचना सहित स्वास्थ्य क्षेत्रमा समर्पित भएका छौं. I think that's a great message. And I know how much he means this. Every cell of his body thinks about this every time. Sometimes it gets difficult for me, but I know how passionate he is about implementing this change in Nepal. So, how is Mediciti going to make this difference? I see 7 or 8 possibilities. Number 1, collaboration with NRNA. One of the foremost names in oncology in the world has already partnered with Mediciti for oncology. We are talking to people in Johns Hopkins for possible collaboration in IBD and gastromedicine. We are talking to ENT, our ENT programs are talking to the University of Lausanne and Bern. UBMC for endoscopic base of skull procedures. We are also talking to All India Institute of Medical Sciences with Dr. Ram Gimide for radiology, Peking Cancer Hospital, and NIMHANS when it comes to mental health and sciences. Dr. Sunil Sharma, that is Dr. Sunil, our medical director with over 8 years of fellowship in the UK. He did his fellowship in general surgery in UK. He did his fellowship in oncology in Singapore and South Korea, and has been a professor at the Kathmandu Medical College. And the reason he joined is because he felt it is now time to make a change in Nepal. Dr. Gopal, who is not with us today, ex-Medanta and a person who very experienced with projects and operations. So, I'm going to end here and take another 2-3 minutes. But I'm ending, so if you want to think about Mediciti, this is one line for all NRN community members, because your parents are here. You're making money there, but there is guilt, somebody taking over our parents. And therefore we've come up with a simple program called Abhibhavak Prati Samarpit. Annual and ongoing care for our elderly parents and guardians. Right? Let's face it, it's not easy to get old. And therefore we need to give some attention to our parents. Pascha jivati jharjhara dehe. Varta kopina prichati gehe. Adi Shankara said this thousands of years ago. He said that your skin is old. Nobody even has time to speak to you. As Mediciti, with your parents, with the NRN community parents, every 3 months. We will have once every 3 months Lifestyle counseling, in yoga and movement, they go down if they have a fall. We have to prevent them from falling in the bathroom or otherwise. So education sessions on fall prevention, education sessions on diet and nutrition, because some of them aspirate and don't have enough nutrition. Education session on infection prevention, osteoporosis, hypertension, diabetes, dementia. Quarterly lifestyle prescription for nutrition and yoga. Standard lab tests for CBC, lipid, etc., etc. Quarterly, our team from Mediciti will go home and make sure we check them on their compliance with medication, nutritional status. Quarterly physiotherapy and rehabilitation consultation. During Dashami or some festivals, I know people go back to their hometowns. If they don't have an attendant, we will send somebody from here to your homes for 2 days at a time, so that your parents have an attendant, and therefore biannual respite care, annual comprehensive health checkup, and of course during Father's Day or Mother's Day, a treat and a remembrance. And we will send the photographs back to you to wherever, whichever part of the world you are. 24/7 immediate responses during emergencies and ambulance pickup, and of course we will pick them up from wherever they are, Nalakale, Bakbateni, I'm just learning the names in Kathmandu, and bring them to Mediciti so that they don't have to wait or find a driver. And we want to keep them healthy and happy. With the NRNA, I sincerely hope that you will join us in this movement, and thanks very much for your participation.